Hello everyone, this is Mila. Today I'm reading chapter 10, Autoimmune Disease. Being the youngest of 6 children, Mark had to be tough just to keep up with the others. He has a healthy little guy who lived anything that had to do with playing ball and a good habit of competition. He was involved in several sports, but soccer was his all-time favorite. One day, when Mark was 12 years old, he was aggressively running the ball in soccer practice when he started cramping up. Soon, he was doubted over the severe stomach pain. The cramp continued to mount over the next few days with both diarrhea and vomiting. When Mark didn't respond to any over-the-counter medication, his parents finally took him to the emergency room where he was diagnosed with appendicitis. After a brief surgery and recovery, Mark was released from the hospital. He wasn't home for long. He returned to the hospital within 24 hours due to increasing abdominal pain, bloody diarrhea, and vomiting. Mark was now much sicker than he was before the operation. The young boy was readmitted to the hospital. However, the local doctor was puzzled. They referred Mark to the pediatric gastroenterologist department at Loma Linda University Medical Center. The doctor placed him immediately in the pediatric intensive care unit. They performed a colonoscopy. The next day, took several biopsies of his small bowel and colon. When his parents saw during the procedure on a video display, made them stare in disbelief. Later, they described to me how the entire lining of Mark's bowels looked like a cobblestone street. The Loma Linda physician diagnosed Mark as having autoimmune disorder called Crohn's disease, as well as secondary bacterial infection called C. difficile. Mark was in severe pain and discomfort. As you may imagine, a pretty tough haul for a kid. His physician immediately prescribed 200 mg of prednisone as well as antibiotic and narcotics pain medication. They consult surgeons and daily debates began to whether they should remove a large portion of Mark's bowels, but they opted to watch Mark's progress over the next few weeks. Mark slowly improved, and a repeat colonoscopy showed that the infection had cleared. This made the typical ulcerative appearance of Crohn's disease all the more evident. The doctor met with the parents and informed them that this was incurable autoimmune disease. They explained that for some reason, Mark's immune system had started to attack his own bowels, which created tremendous inflammation and deterioration. The team of physicians want to place Mark on a chemotherapeutic drug called Autoimmune. Even though he was still sick, very high dose of prednisone and narcotic pain medication, Mark started on Autoimmune. And after the total 6 weeks of hospitalization, the boy was delighted to be discharged. Again, his home stay was briefly one, and within a week, Mark was in so much autoimmune pain again, and he had to remain to the hospital. Physicians generally treat patients with autoimmune disease with drugs that suppress the immune system. Since the body's own immune system is attacked, it is logical to aggressively quiet its activity, but one of the major side effects of these potent drugs is that they whip out the natural antioxidant defense too. Mark's Crohn's disease was finally coming under control, but his suppressed immune system left him vulnerable to all kinds of infection. A cold would return to serious pneumonia. The common flu would put him down for weeks. In fact, during the first year after his initial attack on the soccer field, Mark had to admit 7 times as a result of serious infection. It was about this time that I became involved with the young boy. Mark's father approached me for medical advice following a meeting I was speaking at San Diego and asked what would I recommend. I told him I would put Mark on patent antioxidant mineral tablet among the high dose of grape seed extra and Q10. I also encouraged his parents to be sure he was getting adequate amount of essential fatty acid in his diet or supplements with flaxseed oil or fish oil. All of this would restimulate Mark's natural antioxidant defense system. Mark slowly began to improve but still struggled with abdominal pain and side effects from the drugs. Gradually, his doctor took him off prednisone but not the Imuron. Mark's mom did consult with me again. I recommend that they seek a second opinion for private pediatric gastroenterologist. After seeing how Mark was doing, aside from Imuron's side effects, the private gastroenterologist felt that it would be well worth trying to get Mark off all the drugs, including the pain medication Imuron. He was gradually taking off the Imuron, and within the help of the psychiatrist who taught Mark some relaxation technique, he was finally able to stop taking all pain medication as well. At least Mark was medication free and felt better than he had since that day of his first attack. Mark is now doing great and eating a normal diet. I was delighted to see the active 15 years old again recently. What a frightening and painful experience he and his parents endures. A disease that for many offer little hope is manageable for Mark. He is now pain-free without having even a flare up his colon for more than 2.5 years. Needless to say, we are all optimistic about Mark's future. The landing question is, how could Mark's immune system turn on him like that? Isn't our immune system supposed to help us? Let's start by looking at how our immune system should work. The immune system, our great protector. Our immune system guards us against viruses, bacteria, fungi, foreign protein, and abnormal cancer cells. It is a sophisticated interplay of many different kinds of immune cells. Even though the scope of this book does not allow me to go into much detail about intricate working with the immune system, I still believe it's important for you to know who the basic players are. Here is the briefly job description of each. The different players in our immune system. Macrophages, phagocytosis are the Pac-Man-like white cells that are the first lining of defense. They quickly attack any foreign invader, virus, bacteria, and actually gobble it up. But sometimes macrophages are not sure if they have attacked themselves for foreign invader or not. They definitely do not want to destroy something that is part of the body, as in Mark's case. It is when they call for help with the T helper cells. T helper cells are formed of a group of white cells called lymphocytes. A helper cell come along, attack itself to macrophages and try to help it determine if the particular of macrophages has its gassed friends or foe. If the T helper cell determines that it is an enemy, it will secrete hormone called cytokines. They stimulate the inflammatory reaction, which literally signed the immune system to kick themselves into higher gear. This stimulates the B cell into action and detect more macrophages and T helper cells to come to rescue. B cells have the ability to shut down the intruder with enzyme that destroy it by creating oxidative stress. Some of the B cells will return to the lymph nodes to create antibody against this intruder. If these intruders ever show up again, our immune system is ready for because of its antibiotic. Natural killer cells can destroy anything in their path. They flood the infected cells with toxin and destructive enzyme, which effectively destroy all foreign invaders of cells that are growing abnormal, such as cancer cells. T suppressor cells are the root police that come along after the foreign invader has been destroyed, try to calm down the tremendous immune response. They are critical for the control of collateral damage. If this highly reactive response goes unchecked, tremendous dangers to the surrounding normal tissue could occur. This is what makes the inflammatory response so dangerous. Though it's absolutely necessary to control potential infection intruders. If the inflammatory response gets out of control, it can cause great harm. You have already learned that nutritional supplements have significantly enhanced the body's natural antioxidant defense. In this chapter, you will also begin to realize that same nutritional supplements can significantly enhance our body's own immune system. Dr. Karl-Heinz Schmidt states the optimal functional of the host defense system depends upon adequate supplies of antioxidants, micronutrients. It only makes common sense that if our immune system is going to be able to protect us, God's intent, we needed to have all the nutrients present at optimal levels. Nutrients and our immune system. Again, let's examine the medical literature, see how each of these individual nutrients actually affects our immune response. Vitamin E. Macrophages are deficient in vitamin E, release more free radicals, and do not live as long. Our immune system uses this production of free radical to destroy this foreign invader by actually creating oxidative stress. This is the good side of oxidative stress as long as it remains under control. Vitamin E deficiency also affects the difference of our T cell in the times it leads to the imbalance of T helper and T suppressor cells. The poor production of T suppressor cells is one of the main reasons that the inflammatory response can get out of hand. Remember that the T suppressor cells are the real police, are essential to cooling the immune reaction, so limits collateral damage. Some researchers believe that poor T suppressor cell function is the heart of autoimmune response. Study shows that supplementation with vitamin E correct this deficiency in our immune system and help clear infection. Clinical studies have also demonstrated that immune-enhanced effects of vitamin E supplementation was even greater in elderly and in individuals who had malabsorption syndrome. Mark's disease, for instance, involving both the small bowel and colon, which essentially created malabsorption of these nutrients. Vitamin E supplementation can also protect against the immunosuppressive effect of cortisol, which is released in a great quantity during a stress reaction. Carotenoid. A well-known property of carotenoid is the fact that they are capable of protecting the surrounding normal tissue for potential damage created by the inflammatory response of the immune system. Supplementation of the carotenoids can increase the number and effectiveness of T helper and the natural killer cells, which you have already learned constitute an important part of defense system against cancer cells. This greatly improves the tumor surveillance of our immune system. Vitamin C. Dr. Linus Pauling has been influential in making everyone aware of the importance of supplemental vitamin C, its ability to enhance the immune system. Although we are still arguing whether massive doses of vitamin C are helpful for the common cold, the enhanced effects on the immune system are fairly well established. Vitamin C has been shown to improve the function of the macrophages. This significantly improved the first line of defense against bacterial infections. It is wiser to take good dose of vitamin C daily rather than massive dose only when you think you are coming down with infection. In one study, take 1 gram of vitamin C daily for more than 2 months showed struck enhance of several aspects of the immune system. Vitamin C also had the ability to regenerate vitamin E, handling the excessive free radical within the plasma. Both of these properties further enhance vitamin C ability to improve the immune system. Glutathione. Supplementation with the prosecutor of the glutathione, N-acetyl-L-cysteine, selenium, niacin, and vitamin B2 have shown significant enhancement to the overall immune system. Even patients with HIV infection have experienced this positive effect. Coenzyme Q10. As we age, Q10 level decline make the mitochondria the funnels of the cell. Especially vulnerable to oxidative damage, Q10 is critical for the optimal functioning immune system because the major role in the production of energy in the cell of immune system. Supplementation of the Q10 has been shown to reverse this problem and significantly enhance the immune system. Zinc. Just about every aspect of our immune system needs zinc. A deficiency actually suppresses several parts of the immune system. The number of lymphatic cytos decrease. The function of many white cells is severely reduced, and the level of thymic hormone, which is a strong stimulus of immune system, fall. Many people reach their zinc lozenges whenever they could get a cold. Studies have shown that taking these lozenges every 2 hours can shorten the length of cold by several days. Researchers believe that zinc not only boosts the immune system but also inhibits the replication of the virus. But a word of caution is necessary here. If a person consumes a high dose of zinc for too long, you can actually suppress the immune system. I'm not against short-term use of high dose of zinc or even vitamin C with cold, but I believe consistently long-term use of optimal dose of these nutrients in supplementation is better for the antioxidant defense system and immune system. When all the players of our immune system are functional at their peak capacity, our overall health is obviously the beneficiary. Children are able to optimize their immune system via nutritional supplementation within the 6 months. Aging is generally associated with impairments of our immune response, which lead to increased frequency and severity of infection. In fact, infection, especially of the respiratory tract, are the fourth most common cause of death in elderly. The British Lancet recently reported a study in which elderly patients received either optimal level of nutritional supplements or placebo. Those patients who received the nutritional supplement had significantly improved of their overall immune response and enjoy a few less severe infections compared to those who received the placebo. It took at least a year of supplementation to optimize their immune system, but in the end, the benefits were dramatic. This study, among the several others, confirmed the fact that our immune system is extremely dependent on these micronutrients is our antioxidant defense system. The inflammatory response. You have seen throughout the book that inflammation is a serious foe. You understand that heart disease is really an inflammatory disease and not a disease of cholesterol. Mark's devastating problem were all the results of inflammation of the bowel. In chapter 11, you will read the millions of us are developing arthritis because of increasing inflammation in our joints, and the underlying cause of asthma essential inflammation. Simply put, most of us just have too much inflammation in our body. We needed to bring this excessive inflammation back into balance. Nutritional supplements are the key. The inflammatory response is the result of complicated chain of events involving the immune response, which release tremendously amounts of free radical, castic enzymes, and inflammatory cytokines. We have looked at the basic immune response, but we now needed to look at how to handle the prolonged inflammatory, chronic inflammation response that these cytokines created. Antioxidant supplements are the best too. They improve our immune system, They help control the inflammatory response. They help build our antioxidant defense, which in turn protects our normal cells from inflammation destruction. But there's another important aspect of this inflammatory response we needed to look into: our body's natural anti-inflammatory system. That's right. Has this ever crossed your mind as you reach the bottle of Advil that your body makes its own anti-inflammatory products? Let's take a look at what those products are. Essential fatty acids. Not all fats are bad. In fact, essential fat is just that essential to body. The body cannot manufacture this fat, and therefore must get them from food. But the body uses fat for the production of healthy cell membrane as well as certain hormone called prostaglandin. The two most important essential fatty acids are omega-3 fatty acids called alpha-linoleic acid and omega-6 fatty acid called just linoleic acid. Our body turns omega-3 fatty acid into prostaglandin that are primarily anti-inflammatories. Omega-6 fatty acids become prostaglandins that are primary inflammatories. The generally accepted optimal ratio of dietary intake of omega-6 fatty acids and omega-3 fatty acid is 4:1. This means we should take in 4 times as much omega-6 as we do omega-3. Omega-6 fatty acids are abundant in Western diets. They are in our meat, dairy products, processed foods. We get omega-3 from vegetable oils such as flaxseed, quinoa, pumpkin, soybeans. These fats are also found in such cold water fish as mackerel, sardines, salmon, and tuna. You may guess the average American consumes a few more omega-6 fatty acids than omega-3. A lot more. In fact, on average, we consume a ratio about 20:1 or even 40:1 of these fats in our diet. This results in our body producing significantly more inflammatory products than anti-inflammatory products. Our body being simply too inflamed. The imbalance in the consumption of this essential fatty acid is the main reason for the imbalance in our body's production of these hormones. This is why many individuals in the industrial world need to take flaxseed oil, fish oil in a supplementation in an attempt to bring this back to the balance. Here's another unknown fact. Essential oil or essential fats also have the ability to actually decrease our body cholesterol level, our LDL bad cholesterol level. This means that all fats are created equally. I not only encourage my patients to supplement the omega-3 fatty acid, but also to decrease their intake of saturated fat. When you combine these two efforts, the inflammation in the body readily come back under control and your cholesterol level improved. Several studies have shown significant clinical improvement in patients with rheumatologic arthritis, lupus, heart disease, multiple sclerosis, and almost any disease that involving inflammation when they consume these important essential fats in supplementation. This is very important aspect of maintaining your health or regaining your health if you have already lost it. We have looked at various aspects of our immune system and how it is supposed to work. We have now looked at the problem with this normal inflammatory response gets carried away. But now we needed to look at the very worst scenario. What happens when our immune system mounts a mutant and actually start to attack our body own? Autoimmune disease. You've heard the saying, one's greatest strength is also his greatest weakness. This is no truer than the immune system. Many clinical believe that every disease is essentially the result of breakdown of immune system. But in the bizarre of case autoimmune disease, the autoimmune system actually becomes the body's worst enemy itself by attacking normal cells and the tissue. If it's attacked the joint space, we call it rheumatoid arthritis. If it's attacking the bowel, we call it Crohn's disease or ulcerative colitis. If it's attacking the myelin sheath nerves, we call it multiple sclerosis. When it attacks the cognitive tissue of our body, we call it lupus or scleroderma. Why and how does this happen? I learned in medical school that autoimmune diseases were the results of overactive immune system that began attacks the self instead of non-self. But it made more sense to me that in case of autoimmune disease, the immune system, rather than being overactive, had instead become confused and now attack the body rather than foreign invaders as it was designed to do. In a recent review article on autoimmune disease report in New England Journal of Medicine, the author point out that no one really knows for certain why the immune system literally turns on itself. But many researchers not only believe that oxidative stress is the underlying cause of every autoimmune disease, but it is also could be the culprits that cause our immune system to actually attack us. Several studies have documented the fact that root cause of autoimmune disease is involving oxidative stress. As you may anticipate, the antioxidant level in person with rheumatoid arthritis, lupus, MS, Crohn's, scleroderma, and significant decrease. Low antioxidant level have also been shown to increase one's risk of developing rheumatoid arthritis and lupus. The clinical indicator of oxidative stress are also very high in this patient, especially during a flare-up period of this disease. Antioxidant supplementation would therefore be the ideal patient with this autoimmune disease. Not only can antioxidant supplements optimize the natural antioxidant defense system, but they also can enhance our immune system, helping control the inflammatory response. In other words, they can help bring oxidative stress back under control and circumvent this entire variety cycle. Matt's stories. Matt is a successful lawyer in the Chicago area, which is basically means he has worked a long, hard hour to build his practice while working equally hard to balance his priorities with wife and family. His health has always been good, so he never thought much is until the fall of 1996. Matt was attending a wedding when he began to feel some significant abdominal discomfort. He had been extremely busy the 2 weeks prior to the wedding, so he thought he might be coming down with the fluid, but a day or so later, he felt he had been hit by a Mack truck. As he put it, he was so fatigued with the body ache. When his symptoms worsened, Matt decided to go to the doctor. By this point, he was experiencing a wave of severe abdominal pain. Desperate for the relief, he asked the doctor to take out whatever was causing the pain. He underwent all kinds of tests, including CT scans, ultrasounds, X-rays, and numerous blood tests. So you can imagine Matt's shock when no diagnosis became apparent. He was sent home with only a painkiller. Matt had recently been reading about nutritional supplementation and decided to start an aggressive supplement program. But he did not improve very much. He still felt miserable. He felt itchy all over. He remains extremely fatigued. He finally saw a specialist who ordered a blood test called ANA, anti-nuclear antibody. Matt's ANA come back positive at level of 1/640. Normal is 1/40 or less. His specialist told him that he has systematic lupus erythematosus, or what most people simply refer to the lupus. The ANA was an indicator of autoimmune process. GAMOC. His body immune system was actually attacking itself. Once Matt heard this, he increased his supplemental even more and started taking 350 mg Grapefruit extra amount with his antioxidant and mineral. He slowly improved and required less and less pain medication, even though he still had intermediate bouts of pain. The process was long and hard that Matt continued to fight fatigue and flu-like symptoms. By January, Matt was feeling much better and was able to make up for lost time by getting back to work 10-hour days. He was thrilled because he had not been able to work at all for about 4 months. Being able to support his family financially was something Matt was not sure would ever be possible again. When he went back for follow-up visits several months later, his specialist wanted to start him on some chemotherapy drugs, a standard treatment for lupus. Needless to say, Matt insisted that he felt great and was not having any problems. When his specialist looked at his repeat ANA reports, his jaw dropping. He couldn't believe it. "Matt, your ANA has crashed," he examined. "It's only now 1/40 and it's basically normal." He congratulated Matt and encouraged him to just keep taking whatever medication his doctor put him on. When Matt informed him that he wasn't taking any medication, the specialist replied, "I don't know what you are doing, but just keep it up." Matt continued to do well. He's not only been sick for more than 5 years now, and his ANA tests remain negative. In fact, he claimed that he felt better now than he felt before he contracted lupus. So he realized it's not true. Matt doesn't feel like he has lupus anymore. It's a symptom may return and they may not. No one can say for sure, but one thing is for certain, Matt will never take his health for granted again. The important aspect in Matt's story was the fact that he started his aggressive nutritional supplement program earlier in the course of his disease. I have presented a number of clinical stories in which patients were actually able to redeem their health after their disease has progressed fairly significantly. I hope that more and more people will start to supplement their diet before they even get sick, and then become more aggressively with optimize as soon as they realize they had a major illness. A supplement program can't hurt it. It can only help. For detailed information on starting supplementation, see Chapter 17. Thank you for listening. Next chapter, I will be reading Chapter 11, Arthritis. See you next time.